Well, here we are. Hello. Here we are during our social distancing time, and now we're living like we're in the 1940s because we have no electricity because of the tornado that just came through. So we have our campfire over here where we're cooking our breakfast, and then we got our 1940s tractor over here. Look at that. So now we're bringing it to you in the middle of Oconee County with no power. So, we're going to talk to you today about ibuprofen and Motrin, also known as non-steroidal anti-inflammatory drugs. It's in this family of the NSAIDs. This is part of our NSAIDs family, ibuprofen, also known as Advil and Motrin. Okay, but what do we need to know about our ibuprofen? Well, we're going to talk about it. Let's erase it now. What are our ibuprofen is used for pain and anti-inflammatory. Okay, so our side effects. When do you take Motrin again? For pain and inflammation. Our side effects of this medication are gastric distress, heartburn, we also have rash, and our number one side effect of all NSAIDs, bleeding, which is bad. So, for ibuprofen only, we have gastric distress, heartburn, rash, and bleeding. Okay, but what are some considerations you have to talk about when you want to take this ibuprofen that most people don't tell you because they don't want you to know. They don't want you to know. So here's a few considerations. We have to take it with food or milk, right? And we have to be cautious when you use it for kidney or people with liver disorders. And you don't want to use this drug if you have a pre-existing heart condition, because this drug can cause heart attack and stroke. No heart conditions. Okay, and then we have, do you want to take this as an anticoagulant drug? No, because what's the number one side effect? Bleeding. No anticoagulants drugs or therapy. Okay, but with all this said, how are we going to remember all of these considerations? Well, we have an acronym for that. For NSAIDs. NSAIDs. Okay, so we want no alcohol. So if you want to be by your campfire with some of your American honey drink, don't do it, because it's bad. Okay? Then we have salt and fluid retention. Oh, yeah. Don't mind the fire radios going off. It's all good. Okay, and do we want to do it? This could cause acute kidney failure. The salt and fluid retention can cause you to have high blood pressure and kidney problems. Okay, this also inhibits our prostaglandins. And what do prostaglandins do? Prostaglandins, help protect our stomach lining and help with blood clotting. So if you take this drug, you could have stomach problems and, oh, wait, bleeding. Do take with food or milk. You could come over to my house and have some sausage and eggs that we're having on the campfire because we don't have any power. And we want to stop our NSAID medication 1 week prior to surgery. Because why? Because NSAIDs cause bleeding. So if you go into surgery and you've been taking your ibuprofen and they slice you open, you may not stop bleeding and you're gonna bleed out and die. So, this is what we've learned about our one drug Motrin / ibuprofen, also known as ibuprofen, which is in the NSAID family. Number 1 side effect, bleeding. Okay, so remember that next time you take your Motrin. Okay. Really good thing.